This webinar today will explore how the South African healthcare sector, both public and private, are employing cloud and other technologies to enhance service delivery in healthcare. You think of the algorithms, the big data, the analytics that's happening up in the AWS cloud, and how are we harnessing this incredible power of technology to do these multiple calculations, take the data that we've got in to work out the causes and find solutions for critical healthcare issues that we face.
We're seeing within the industry sort of healthcare and life science organizations are really reinventing how they collaborate and how they make data-driven sort of clinical and operational decisions. All of this enabled by advancements within precision medicine, and all with the intent to want to be able to decrease the cost of care that's delivered in both the public and private healthcare space.
I must caution against the expectation of IT determining the critical path toward our solution, but to rather consider how the health system can be strengthened through digital health. And if we start using a system approach and we see how digital health can support the complex adaptive system of the health sector, we would be more successful. And therefore, one of our key interventions into the future is how do we deploy an understanding of digital technology and what we call digital health literacy on both the users of digital technology, but also the receivers of the services, and to build the trust in terms of digital technology.
There's always a 3-letter acronym that you don't know, so you need to understand the vocabulary and how we communicate. What are the practical solutions? What is our architecture? And building sustainable solutions. The collaboration enables the dialogue so we understand what's practical and sustainable for all parties within the ecosystem.
What we have learned, where cloud is really, really making a difference, is that there's definitely a move away from these large, monolithic, enterprise-type clinical information systems to more composable type of architecture. So where we really say, okay, what problems are we trying to solve? And we use that foundation that we've established and build on top of that to solve specific problems, rather than going through with a massive system that is very expensive, very difficult to implement, and often is very difficult then to keep modern and effective going forward.
I think that we're going to move to a wellness-orientated society instead of a disease and curative-orientated society. Human capital consists of a healthy population is a healthy workforce, which does increase things. So agency among people to decide their healthcare and a wellness-oriented health system.
I've been watching this series called The Good Doctor. I'm sure you've all seen it on Netflix, right? And you're watching all these things and listening to you guys this morning, and I'm thinking about all the relevance that has in our discussion in really getting that information out on patient records and healthcare records, and how it could save lives and create tremendous benefit and unlock tremendous value to the citizen. And that's what it's all about. It should be focused on the individual citizens ultimately at the end of the day. Big thanks to the team from ITWeb, and a big thanks to AWS for another incredible discussion and a very, very important discussion in our lives. Ladies and gentlemen, be safe out there. I mean, this pandemic has not gone anywhere. It's still around, and so is load shedding for that matter. Have a great day further. Thank you all for joining us.
Thank you, everyone. Cheers.
Thank you. Bye-bye.